Welcome to the Bestie Perspective,
a podcast where healing gets real,
where we explore the mind-body-spirit connection,
and where becoming your best self isn't perfect, it's personal. So take a deep breath.
You're safe here with the Bestie Perspective. Hey besties, and welcome back to the Bestie Perspective. And today we are diving into another healthcare topic that has the internet in absolute chaos right now. The government just said nursing isn't a professional degree. And honestly, they might have a point. Let's see how you feel after our conversation today. I'll start by painting you a picture. A nurse is 8 hours into her 12-hour shift. She hasn't eaten. She's caught 2 near medication errors. She's managing multiple critical patients. She went to school for 10 years, has over $200,000 in student loan debt. And now, her degree is no longer considered professional. I'm sorry, what?
Bruh.
What exactly is professional then?
How dare they call us not professional? What the hell?
I mean, I know there's some not so classy nurses out there, but we be professional, okay?
It's true. It's true. I mean, look at the amount of education that we have to go through just to have an RN license. Not even an advanced practice degree.
Exactly. So let's break this down really quick because I know this sounds insane. This all stems from a federal student loan policy that's expected to go into effect around July 2026. And basically, the government redefined which degrees qualify for higher loan limits. And nursing didn't make that professional category. So what does that actually mean? If you're in a program like medical school or law school, you can borrow up to about $50,000 a year or up to $200,000 total. But for nursing, that now drops to about $20,000 a year with a $100,000 lifetime cap. Now, to be fair, the goal of this policy is actually to reduce student debt. The government is basically saying, we don't want students taking out unlimited loans anymore, and we want schools to lower tuition. But here's where it gets complicated, because while that might help some students in the long run, for others, especially nurses going into advanced practice roles, that cap might not even cover the cost of their program. So for some people, this could mean less debt, but for others, it could actually make it harder to become the kind of nurse our healthcare system desperately needs. And on top of all this, the reaction has been so loud. Nurses all over social media are speaking up. Some are frustrated, some are hurt, some are straight up making jokes about it. But underneath all of it, you can feel something deeper here. So I'm curious, when you ladies hear something like this, do you think people are reacting to the actual policy or to what it feels like it's saying about nursing? Because that's really the question, right? Is this about money or is it about respect?
Yeah, I feel like it's about both, but what I've seen on social media, I definitely feel like we're reacting to the feeling that it gives us. And because it does hurt if I hear someone say that I'm not considered a professional or that my degree is not considered a professional degree.
Yeah.
I feel like I got cut from a team or like I didn't make the cut. Like I was the last one to get picked for dodgeball teams or something, you know?
He got benched.
Right? The last one. Yeah. No, I agree. I think that's exactly what's happening on social media. It's that emotional, the trigger. Like, how dare you say we're not on that same level? But when it comes to the explanation, that makes more sense to me They're not saying you are not a professional career. It is the category for loans, which all them categories are, some get really dumb anyway. So I'm kind of like, I get it. Are we in as much schooling as law school and medical school? No. So then I guess we should be in a different category because
Yeah.
medical school is more years. So that makes sense when I look at it that way. It's just why they gotta title it that way.
That
Why's it gotta be
way.
called a professional?
Yeah.
Why did it be like that?
Yeah. And like, I know that you go back to school for advanced practice nursing degrees, but even then, it's still usually not as long as medical school, right? I feel like I'm kind of in the dark on that.
I guess the one that I'm thinking about is because I looked into it at one point is nurse anesthetists. I believe, you have to do your 2 years of undergrad, then you do your 2 years of your RN program, and then I believe the anesthesia programs are also 4 years. So that's 8 years of schooling for nurse anesthetists, I believe. So there are definitely advanced practice roles that have, more school. I mean, almost a decade of schooling too. And even though they're
And
nursing,
then doesn't that mean it would fall under the professional category at that point? I think that's where clarification is needed then. Because if you are
Yeah.
advancing above what nurse RN requirement is, then you should be able, or you should be allowed more loans, more schooling, more. So, yeah, I
You would
can,
think.
you would think. So,
That makes
if
too much
that
sense,
is,
Eileen.
I'm, if that's not what they're saying, then yeah, we need some clarification big time.
Yes. And we also aren't the only ones affected. It's nurses, advanced practice nurses, physician assistants, occupational therapists, and physical therapists. So we are not the only ones who are being affected by this policy. But I think there may be like three big layers here to why this is upsetting people. First, I do think it's what the policy is, and then that feeling like we're talking about of what it's saying, because technically they're saying this isn't about value, it's just a loan category. But removing professional, like nursing from a professional category, I think it does mean something to people, like you guys already started to say. And I do believe that is where a lot of the reaction is coming from, because I guess what comes to my mind is we see people naked, right? We're dealing with like very controlled substances and all these things. And it's like, don't you think you'd have to be, quote, professional to handle that environment and do those things? So, do you guys think that's where a lot of the reactions are coming from? Is the fact that they're saying it's not professional?
I think they're definitely getting a lot of reactions from, I mean, I feel like it's the opposite of validation. Our nursing is hard. It's hard work. There's a lot of pressure. And we're held just as responsible for mistakes when it comes to like med errors or anything else that can happen in the hospital, just as liable as pharmacists, just as liable as charge nurses, managers, doctors, PAs, NPs. If we're all responsible for doing second checks and things like that, it's not like we're just checking things off a list. We're critically thinking. There's so many things that go into one shift as a bedside nurse. We've talked about it on our other episodes, how what goes into a shift and what makes it so tiring where you can't even stop for a pee break or stop for a water break and take care of yourself. And the fact that we are willing to put other people before ourselves to that extent, and we're left already feeling with an empty cup. Of course, if you tell me I'm not considered a professional and my cup is empty, I'm going to feel like extra shitty about it.
Yeah, like it's the wording, like we kind of mentioned earlier, for sure. It just feels you couldn't have picked another word or just another way to reclassify the load.
I don't know,
Um,
man.
but I also think a second layer is kind of the territory you were getting into just now. It's hitting a group of people who already feel undervalued. People who are
Yes.
overworked, understaffed, carrying loads of responsibility, like you said, Hannah. So when something like this happens, it's not just about this, it's about everything that's been building to get to
Yeah.
this point. So do you guys think it would hit as hard if nurses already felt supported and respected?
No, it hits hard because we feel unsupported and disrespected. 1000%. I think, if anything, I'm now leaning towards okay, let's just see how these hospitals and how healthcare does when less PAs and nurses and people that, are in this category actually come out of colleges, because they're not even going for the degree because they can't even
Yeah.
afford it, because they can't
Yeah.
get the loans because they're capped. Like, let's see the trickle effect. And I'm so down for these universities actually lowering their ungodly high costs, because like, these people, as far as nurses in this whole category, are the heart. They're so in the middle of making the inner workings of patient care flow well.
Oh
Bring
my
it.
gosh, yeah.
Let's see what happens. Let's see how it goes. I'm like, okay, you're cute.
Let's see. Let's see how the cookie crumbles. Yeah, I mean, even when you think
Oh,
about a
yeah.
hospital visit, I mean, who are you mainly seeing? Not the doctor. Doctors
No.
maybe once a day if you're lucky, but you're seeing the nurses, the physician assistants, the physical therapists, occupational therapists. You are seeing these core of people. So I think
Mhm.
what you're saying, Eileen, is now making me think of the third layer that I see
Okay.
here, which is the timing. We already
Mhm.
have a nursing shortage.
Yeah.
People are already leaving the profession. Burnout is
Yep.
high.
And now you
So
want
to
to make it harder
introduce,
to pay for the degree. Okay.
right. So it's like
Yeah.
to introduce it now just feels backwards considering,
Yep.
right? Am I crazy or does
Right.
this feel completely out of sync with what's happening in healthcare right now?
I am still like so okay with it in for this reason. I know, I'm like, so y'all probably weren't expecting this energy, but it's just like, the abused person that gets that last punch to the face. That's just that final straw, that enough is enough. Like, let's get pissed off, nurses, so we can actually do something about it. Let's do
Mm.
what we need to do to make the changes, because it's like kick us while we're down, or spit us in our face while we're already on the ground, kind of thing. Like, what else? What else are we?
Right.
What are we gonna add to it? So, it's almost like, if this is what's going to be the catalyst to fuel positive change, then it's
Mm.
sad, but let's do it. Let's do it, because perhaps all these nurses that are in that career are the ones that don't speak up, are the ones that complain without implementing change. And maybe it's time for us to stop being that way.
Mm.
Yeah.
Mhm.
Like let this be the paper that stokes the fire of what needs to happen.
Because, people are bitching about it in the break room, but that doesn't help. That doesn't go
Right.
anywhere. We're
Right.
so fine about talking about it amongst our peers and coworkers, but maybe
Mhm.
we got to do
Yes.
something else. Maybe
Yeah.
we got to do
Yeah.
something else.
Yeah.
And I think that's a huge call to action for management, because
Mm.
I remember when I worked in the hospital, I had so many ideas of, oh, we should do things this way or that way, or how big of a difference would it make for our patients if we could implement this, right? But most times in the hospital, it has to be some like big unit study that has to happen, and you have to do it's not very fast moving. It's like the speed of molasses and
Molasses.
trying to get shit done and like to make changes. And then if you do offer change, then the amount of resources and time, and by resources, I mean like adequate staffing, their time in their day, right? If they have to implement something new, is it realistic with their current patient load, right? And then if it costs money, I guarantee you, if it costs money, it's maybe out of the question. Because hospitals don't make enough money, let me tell you.
Yeah.
But I just came from that, and then the job I work now is so like the rapid iteration is crazy. You can have an idea, and they're so solutions focused. Like you could complain about one thing, but then the next question is, well, what do you think we should do about it? And they genuinely mean it. They care about what ideas you bring to the table, and they believe in your experience and
So
expertise. And it
refreshing.
is such a breath of fresh air as a nurse.
Yeah.
I just wish that it could happen more in the hospital. Yeah.
Yes, to be seen and heard. But not only that, actually have your ideas implemented.
Yeah.
Yes.
Yes.
That needs
Yes.
to be the
No more
standard going
bitching in
forward
the break
everywhere.
room.
Bitching in the break room. I like the way that
That's
sounds.
the new title of a song, right? Bitching in
Bitching in the break
the
room with my bitches.
Oh my goodness.
So, yeah, on paper, this is about student loans. But when you look at the message, the context, and the timing, like we have, it makes sense why people are reacting the way that they are. And as I mentioned, there is another side to this because the Department of Education is saying, again, that it's not about value or importance, that it's just a loan classification system. But they're also saying most nursing students, about 95%, won't actually hit these borrowing limits anyway. And the idea is that by capping by capping the federal borrowing, schools might eventually be pushed to lower tuition costs. But here's where this stops being just a policy conversation, because when you move from what's intended to what's actually happening, the impact does start to look very different.
What's actually happening?
Who's actually affected? Because this doesn't hit every nursing student equally, but it does heavily impact students in, as we mentioned, those advanced practice roles: nurse practitioners, nurse anesthetists, doctoral level nursing programs. And these are the programs that can easily cost $100,000 or more. And those are also the exact nurses who go on to lead clinics, to work in rural areas, and fill major gaps in our healthcare system.
To teach the next generation of nurses.
Yes.
Mm-hmm.
And this is where that contradiction hits, because we're already dealing, like we said, with the shortage. And at the same time, we're making it harder for people to pursue the advanced degrees. Does this make sense? Or does it feel like two things literally moving in opposite directions?
Well, that's the thing with the advanced one. Like, it shouldn't be in the same category to me. That's where I'm
You're like,
gonna have to
nursing
disagree
RN
with.
needs to be here and advanced practice needs to be.
Yeah. If we're getting to the pricing of law school and medical school, then let's get into that category. RNs aren't? Okay, I get it. Fine. We can stay in that category. But when you're getting into these advancements, I'm feeling like that needs to be bumped up then. Go with med school and law school.
Yeah.
Yeah. Even looking at just the average time it takes to complete the degree, because I think that matters as well, because more time, more money.
Right. Literally. And the other thing that just popped in my head too is, I didn't do this because my college was right near my hometown. So I lived with my mom throughout college, but a lot of people use the loan money to help fund a place to stay, to live, to eat, yeah. And
Mm.
I mean, think about it, because if you live in a rural town, if you come from, there's so many nurses who came from a poor background. And nursing is what gave them and their family hope. It changed
Mm,
a generational pattern for many people.
yeah.
And it's so empowering to know that they had that chance because they had the opportunity to take loans out and make that happen, even if it meant paying for rent with some of that money along with their books and tuition, you know? And so I want to know
Yeah.
in that fine print when they say that 95% of nurses don't even borrow that amount, is that strictly like a numbers based on college tuition prices, or are they accounting for books? Are they accounting for
Mm,
the money spent, like the total loan amount that, you know, they may be using some of that money for rent to live throughout school? These are
Good
questions I still
question.
have.
Yeah,
yeah,
that's a very good
definitely.
question because tuition only, then then we've got some discord here. Because, yeah, I
Mhm.
think if they are taking into account all the other costs, then the cap might need to be raised.
And even private
Maybe.
versus public. Think about that.
Mm,
Think about how much more a private nursing school program would be versus a
yeah.
public. Then we're talking well over 100,000 for every RN. If
So,
they go
yeah.
to a, when I say private too, I mean like, an Ivy League or, you know, even one of those too. But yeah, I feel like that right there just, it kind of limits where people can even go. But
Mhm.
I also think this is the part that people don't always connect, that it doesn't just affect nurses, it affects patients too. It affects access to care. And because if fewer people can afford or access this nursing education, like we're talking about, that means fewer providers in primary care, longer wait times in the waiting rooms,
Mhm.
more strain on already overwhelmed hospitals. And
This
especially,
is
like we said, in
why
those
I
rural
say bring it.
areas. Yeah. Where think about the rural areas, right? Where nurse practitioners are often the primary providers,
Mhm.
right? What's swirling around right now? Like, any final thoughts?
So
What's coming up?
much. So much. Oh my gosh. No, I think what you're saying about future repercussions and the gap in care that we might see, maybe that's what it's going to take for people to finally respect the career. It's like,
Yeah.
we can't afford it, so we're not going to get a degree. And now you guys don't have nurses. Good luck with the long waits and doctors having so much on their plate and stressed out. I'm like, feel the burn, not like a workout.
I led his team. Let them burn.
Fine. See how well you do without me kind of
It's very
attitude.
true. It's so true, though. I mean, think about even, if we've ever had people even in our lives that we maybe didn't treasure them the way we should have, and then when we don't have them in our lives anymore, you feel that big difference. You're like, oh my gosh, those little things they actually did really mattered, really helped. And like we said, with the core of people that this is affecting, the main people that you see when you are in the hospital,
Mhm.
how is it not going to have an effect? And I
Yeah.
feel like we're living in an era as well where, remember, it used to be, oh, well, go to college, get a degree because that'll make sure you get a job. We live in a culture now where it's, you need to have a master's. A bachelor's degree is no longer enough. So if we're now making it harder for people to even do that in nursing, what are we doing?
Mhm.
Let it burn. No.
Mhm. Mhm. Yeah, and
Oh
like
my
another
gosh.
thing that I think about too, like something that's been swirling in my head through the whole episode has been, again, with the feelings, right? Like
Mm,
nurses naturally, most of us are extremely empathetic. We're feelers. We can connect with the patients easily. We're people person. Like we're people.
People.
We're people. Like I'm a people person. Y'all are people person. Yeah. So, you know what I'm trying to say. And so to me, it made sense when I saw all those posts going viral of people saying, oh, they want to call me not professional, my degree not professional. Like we do take stuff to heart. And I think that might be honestly a wake up call for nurses that maybe that's an area for growth for us, maybe to like as a profession grow with our emotions and like learn from them and like realize, oh, if I didn't react to something right away, maybe I would have noticed that deeper layer that this is not just about a name classification, but there's money involved. There's like deeper goals, like who is this going to impact? And I feel like if we had begun to ask those questions a little bit sooner, like I didn't know, but there was actually apparently a public comment period for this where they were taking comments from nurses, real nurses like you and me. And God, if I had known, I would have definitely said something. But all I saw on social media was, we're not professionals anymore.
Wait, how did that go?
Well, I know, right? So I think that's what brings me to like, what can we do past complaining about this time? What maybe there are groups of nurses out there already doing something, maybe more research as to what we can do or should do that's going to help the future of this career. That's where my mind goes. That's now the next step. Like, can we do? Where is our power? So I would just ask anyone out there, any nurses out there, if they've come across that. What do we do? Okay, this is happening. We don't like it. Cool, let's just make a podcast episode about it and that's it. No! What else can we do? Where can action be taken?
There has to be someone out there or a group out there doing stuff. We just have to find out. Listeners, if you know, like tag us, put in the comments or something.
Let's get our pitchforks and torches, ladies.
Oh, goodness.
So, as we close today, I want to finish with this. At the end of the day, this isn't just about student loan limits. It's about what's being communicated and who it impacts. Because the nurses who are going to feel this the most are the ones stepping into those advanced roles, the ones filling those critical gaps, the ones we already don't have enough of. And whether you're in healthcare or not, you may never become a nurse, but one day a nurse is going to be the one taking care of you or someone you love. And with that, thank you for sitting with us through this conversation today. This is definitely one of those topics that really matters, and we're grateful that you're here having it with us. We want to hear from you. How does this land for you? We obviously shared a lot of different opinions, ideas today. Do you feel like it's about money, respect, or both? And if you're in healthcare, what's your perspective?
Or if you have any suggestions, though, share with us if you have any, like, hey, why don't we all team up and do this, right? Let us hear
We
you.
got till July.
Right. My suggestion to the patients is don't take care of yourself now and don't get sick, okay? Ever.
Yeah, right. Because between people getting their degrees with AI and this policy in effect, I mean, our healthcare system is getting scary, y'all.
We're going to go back to grandma's kitchen cabinet when we get sick.
I'm here for that, honestly. So, side note, so funny to think about how we started there, then we went away from it, now we're coming back again. Another topic, another time. But If this episode today resonated with you, please send us to someone, a nurse, a friend, a future nurse, anyone who deserves to be a part of this conversation. And we're going to keep having conversations like this, real, honest, and sometimes uncomfortable, because that's where growth actually happens. And if you want to connect with us individually, you can find all of our information in the description below. And if you want more of this bestie magic, you can follow us on our socials at the Bestie Perspective. As always, keep growing, keep glowing, and always trust in your own bestie perspective.